Hi, my name is Maggie Klein, and I am currently an Indiana State University BSN student, and I am presenting a topic about tobacco use among adults 18 and older and the impacts on their long-term health. So our learning objectives, we will be able to identify the current tobacco products on the market, identify the effects of smoking and what it has on the body and health. You'll be able to state the reason why people start smoking. You'll be able to identify why this population is at risk. You'll be able to identify prevention methods for youth and adults and identify the current smoking cessation options. So before we go any further, I want you to take this pre-test. There's 10 questions. They're all multiple choice and there are answers at the end. And this will just be a basis of what your knowledge is, and then we'll have a post-test to see how much you've learned. So the reason that this is a population at risk is because 26.7% of Erie County adults, where I currently reside and practice, are smoking. The Healthy People 2020 goal for adult smoking is 12%. So we're more than double that. And the current rates are up from 20.8% in 2008. So despite all the national coverage on the dangers of smoking, clearly there needs to be extra work done in my community to educate the population of Erie County in order to decrease the number of smokers, because we went up 5-ish% since 2008. So the current tobacco products available would be cigarettes, cigars, e-cigarettes, smokeless tobacco, otherwise known as chew or dip, hookahs, or pipes. And in this image that I have off to the side, it shows, this is based on the national average. So the national average of smokers is 27.1% using any of these or multiple of these tobacco products. The biggest thing right now is e-cigarettes. They came out a few years back and they have really picked up popularity in the last couple of years and is now the leading tobacco use product especially in high school students. So the health effects of smoking. Smoking causes cancer, heart disease, stroke, lung diseases such as chronic emphysema, COPD, and diabetes. And then it can also put you at risk for developing tuberculosis, eye diseases, rheumatoid arthritis, and other problems associated with the immune system. And that all came from information on the CDC website. So off to the side, this is actually a video. For some reason it didn't upload correctly that you could just click on it and play the video. So I do have the hyperlink off to the side underneath of my information on reasons why people start smoking. It's a really good reference. It shows exactly how the brain interacts with nicotine and how it can become addicting and what it does to your body. So it's kind of interesting. It's not very long, maybe 8 to 10 minutes. And then the reasons why people start smoking: 71% of adolescents experiment with smoking. Parents who smoke also increase the risk that people 18 and under smoke. Low income levels and low education has been proven to impact the rates of smoking. In my community, we tend to be a lower economic status, lower education level, directly, especially in Erie City, rather than all of Erie County. And obviously peer pressure, media influence, advertisements, and stress all contribute to smoking. But really the low education and low income levels are the biggest impact on reasons why people start smoking. So prevention methods for adults and youth. Adults, the warnings on tobacco products, banning smoking in certain areas, health communication campaigns, increasing the price of tobacco, and having smoke-free policies. I'm pretty sure we could all identify areas where you can't smoke, most of them being hospital grounds, school zones, places like that. They do have smoke-free policies. And then health communication campaigns, we see them all over TV, radio, advertisements. And the price of tobacco itself has gone up astronomically in the last 10 to 15 years, hoping to deter people from starting to use tobacco because it's very expensive. And then higher levels of education have been shown to be preventative measures. So even just encouraging people to get their high school diploma and even go to a technical school or go on for their undergrad or their grad, the higher levels of education that you go has been proven to be a preventative effect on the use of tobacco products. And then with youth, they actually recommend that primary care clinicians provide interventions like education or brief counselings during like their well child or just their normal checkups or vaccination timeframes. And that counseling actually helps to prevent initiation of tobacco among school-aged children and adolescents. So there are multiple smoking cessation options, but these 5 that I have listed I think are the most important. Number 1, stick to your plan. Pick a date, make a plan on how you're going to quit, whether it's you quit cold turkey, you already have an appointment coming up with your primary care to maybe do medication assisted quitting of tobacco. However you decide to make a plan, make your plan, pick a date, and stick to the plan. Get support. That has been proven to help astronomically with quitting. Surround yourself with people who support your decision. Don't be around other smokers. That temptation will be there, and that makes you at higher risk to relapse. And, there are multiple support groups, tons of places that you can go, forums. I know on the CDC website, they also have a whole section on tips from former smokers that you can review their videos. There's articles. So any type of learning style that you have, the CDC has that on their website. And those support groups can also help you to accomplish your goals because they're all going through the same thing with you. And then stay busy. Being busy helps keep your mind off of smoking. Pick up a new habit, a healthy habit. Replace that old habit with a new one like exercise or meditation. And that'll help also decrease stress levels that can rise during the process of quitting the use of tobacco. Avoid smoking triggers. Throw away all your smoking supplies. Don't have lighters. Don't have packs of cigarettes laying around. Don't have cans of chew. Get rid of all of your supplies and spend time with non-smokers because that temptation won't be there. And then stay positive. In the pre-test and the post-test, I have questions about how many times it takes for someone to quit for good. And surprisingly, it can take up to 30 tries for an adult to stop smoking. So if this is your first, second, fifth, 10th try, don't get discouraged. It doesn't mean that you can't quit. It may just take a couple more tries. Stay positive. Often people have relapses. Get back on the horse and try and do better. So this is the post-test. I want you to take the post-test and see and compare it to your pre-test and see how much more you were able to answer the questions after the presentation. And again, there are answers at the end of the post-test just to be so you know what you got right and what you got wrong. So for more information or resources, I did list that CDC website about quitting smoking and the tobacco campaign and tips from previous smokers. That's the first and the third bullet there. And then I also listed a website for quitting tobacco use from a cancer website.